There is a huge potential for medical tourism in the Middle East as well as in the subcontinent countries. Earlier, people used to travel west for any medical facility. They used to travel west. Now, recently, we have seen a lot of people traveling to the east, to countries like Thailand, Singapore, then Malaysia and all. But India is now becoming a big hub for medical tourism. Like that, in the Middle East, Dubai is becoming a big hub. So we have the advantage of being here in UAE as well as in India. And many of our facilities have got the world-class equipments as well as people who can provide any treatment, starting from simple treatment like operations, usual laparoscopic operations to the robotic surgeries. So we are getting large number of patients from this side, and we hope that this will be increasing now every year. See, 3 reasons why people travel from one country to other for any sort of medical value is one, the availability of expertise. If there is availability of expertise, then people will travel to that country. The second one is the tariff differential. If there is a cost advantage, people will travel. And the third one is the waiting period. If you can reduce the waiting period, people will travel. So we have all these advantages because there is a cost differential, there is expertise available, and there is no waiting time. So there is no reason why people shouldn't come to our facilities in the Middle East as well as in India. And I hope that this will increase. And I really appreciate the initiative by the government of Dubai as well as the Department of Health and other bodies here to attract more patients to Dubai and making this into an international hub for treating patients, because Dubai is a hub for everything. Medical tourism is another area now developing, and more patients will be coming here for treatment. I hope this will go in a great way in the next decade.
Following the vision of Sheikh Mohammed bin Rashid Al Maktoum, the ruler of Dubai, to make Dubai the leader across all industries. Now comes the health tourism. As a directive from His Highness, we were instructed to make Dubai #1 in the world for health tourism. From that, the DHA has started the initiative of making the club, or what we called it as the tourism club, the health tourism club, between the government as well as the private sector. We are very proud of this initiative, and we have been the initial part to start this club, to take it forward. And we found that there's a lot of support from all other government sectors, as airlines, hotel industries, government, immigration, to facilitate this initiative. And we are moving very fast to be #1 according to Sheikh Mohammed's vision.
Medcare Hospital is Dubai's new 64-bed premium private general medical facility and is the first in the new Dubai area to offer advanced medical care and emergency services.
So Medcare has been a big part of this initiative for health tourism in Dubai. We are the main contributor right now for this industry, and we are supporting not just the Medcare to grow, but our first aim is to make Dubai is #1.
The hospital has a fully fledged emergency department, 25 outpatient consultation rooms.
We have many facilities, and we are expanding across UAE and the GCC to provide services to all sectors. Right now we have the Medcare Orthopedic and Spine Hospital, which is the first orthopedic and spine specialty hospital in a private sector, which is the aim for our health tourism. This is the main part of our health tourism and what we offer to patients outside the UAE. Other services including obesity. Medcare Hospital offers one of the biggest operation of obesity or paediatric surgeries. We're averaging around 150 surgeries per month, which is one of the largest numbers in the Middle East.
All the departments are manned with highly experienced staff providing accurate, reliable and prompt care quality services of international standards.
In Medcare, we cover everything other than cardiac and invasive cardiology. So we promote all of them, but in a different scale. As I said, the Orthopedic and Spine Hospital is number one, pediatric surgery is number two. By January 2016, we will also offer the first private hospital, a women and children hospital, that will cater only for these two categories, which will be an attraction because it will be one of a kind and one of the first in the region. That will be attraction for women and children with full spectrum of subspecialties.
All senior medical staff are well qualified and also accompanied with highly talented and experienced nursing staff.
To achieve our goal to be an attraction for internal customers and external customers, meaning the patients from outside the UAE, we must have the staff and the facilities to support that. Patients usually comes to facility that looks good for the first time, but to come back, they must find the service that meet their demands and to basically cure them. So from that point, from that perspective, we take care of from our all our staff, not just the doctors. There is a lot of concentration on the doctors, but that's not the only aim for us. We aim that the patient has to have an experience from the start from the entry of the hospital till they leave the hospital. The experience has to be equivalent. Medcare, as we stand right now, we have two hospitals with around 100-bed hospital between the general hospital and orthopedic and spine hospital, and also we have 12 satellite clinics, standalone clinics with subspecialty as an eye center, IVF, pediatric center, and physio and rehab center. By the first quarter of 2016, two more hospitals will be inaugurated, a women and children hospital with about 75 beds, as well as the first hospital, private hospital for Medcare in Sharjah, which has about 120 bed hospital. So by the first quarter of 2016, we will probably reach around 320 beds as Medcare. We also have just signed another hospital in Dubai, which will add another 75 beds. So we're hoping by 2016 we will reach around 450 to 500 beds, and many more other projects are coming on the pipeline. Our goal is to have around 750 beds by 2017 to cater to all specialties, with giving more focus on specialty hospitals.
Medcare will continue to build on its talent, expertise and commitments, constantly seeking new opportunities to provide innovative services. Medcare Hospital, a caring mission with a global vision.
So we are welcoming people to only not to just experience the lifestyle, the fun in Dubai, but also to examine and experience the healthcare of Dubai, which is no less than any other services that Dubai is providing. We are here in Dubai. We welcome you to experience that, from health packages, health checkups, to pediatric surgeries, across all the healthcare we can provide, and we promise that we will treat you well.